ARDS. ARDS is a life-threatening form of respiratory failure. Lung inflammation. ARDS is a diffusion problem, severe impairment of gas exchange. When O2 reaches alveoli, which is tiny sacs, but can't cross the damaged alveolar capillary membrane. Alveolar capillary membrane is the thin lining that surrounds the alveoli, which is the tiny air sacs. ARDS is refractory hypoxemia. Hypoxemia is the O2 does not improve with oxygen therapy. In ARDS, patients do not improve with oxygen therapy. What causes ARDS? What causes ARDS is inflammation triggered by infection, trauma, or severe illness. In a severe illness, infection, and trauma, it damages the alveolar capillary membrane. It's the wall where O2 and carbon dioxide swap between lungs and blood. So that causes increased capillary permeability, which is blood vessels become leaky and it leaks into the alveoli. When it leaks into the alveoli, it becomes non-cardiogenic pulmonary edema, fluid accumulation in the alveoli. So now the fluid, non-cardiogenic pulmonary edema, dilutes the surfactant, and the surfactant is what keeps the alveoli open. And with loss of surfactant comes atelectasis, which is alveoli collapse, and the lungs become stiff. So when the alveoli collapse, lungs stiff, it causes gas exchange failure. Impaired gas exchange equals severe hypoxemia, which is low O2 in the blood. And it also retains carbon dioxide retention, which causes respiratory acidosis, and it leads to refractory hypoxemia. Risk factors of ARDS. The number one risk factor of ARDS is sepsis. Sepsis is when an infection spreads and the body goes out of control and it starts to damage itself. So sepsis is direct lung injury. And direct lung injury is initial damage that starts inside the lungs. Some examples of direct lung injury: pneumonia, smoke, drowning, drug overdose, aspiration, inhalation, and chest trauma. What also causes risk factors is indirect lung injury, like it's inflammation that starts outside of the lungs. Sepsis, shock, trauma, pancreatitis, COVID-19, burns, multiple blood transfusions. So now, early signs, what you see first in ARDS. In early ARDS, lungs will still sound normal, but the crackles appear later. So the early signs you'll see tachypnea, tachycardia, increased work of breathing, retractions, use of accessory muscles, cyanosis, confusion, restlessness, diaphoresis, and needing more oxygen. Those are early signs. Now, late signs of ARDS is severe hypoxemia, mottled skin, respiratory acidosis, fatigue, respiratory failure, vital signs, blood pressure decrease, heart rate increase, and whiteout bilateral lungs. Now, ARDS. The gold standard to detect ARDS is a chest X-ray. Bilateral infiltrates. Both lungs is required to have, both lungs have to have bilateral infiltrates, need to have whiteout appearance to have an ARDS diagnosis. Nursing interventions of ARDS. The first nursing intervention in ARDS is breathing is failing, so oxygen is always first. High flow oxygen, prepare for intubation, mechanical ventilation, PEEP to keep alveoli open, and suction. And if all those don't work, then we go to ECMO. ECMO acts as a heart and lung bypass. It oxygenates blood outside of the body. ECMO does not treat ARDS, it just buys time to keep them alive. Second, you have prone positioning, head of bed at 30 to 45 degree angle. Then third, you have fluid management. ARDS is leaky. It means extra fluids, so avoid extra fluids. ARDS, patient worse after fluids. So question the order if the doctor prescribes like IVs or any fluids. They need actually diuretics to get all the fluid out of them. Okay, so the PEEP. The PEEP keeps alveoli open. PEEP range is 5 through 15. Anything after 15 causes hypopneumothorax, barrel trauma, barometer trauma. If a patient has this, notify provider and prepare for reduction. Okay, prepare for reduction. So that's ARDS. So that is ARDS.